So, starting with a clinical vignette, so let us see that this is a 27-year-old woman who presented with profuse mucoid non-foul smelling discharge. Remember, this discharge was also non-blood stained, and the last year discharge was 3 months ago. And when looking at a pure tone audiometry, it showed a 40 decibel conductive hearing loss on the affected side. So, you look at the picture here, you have a left tympanic membrane, you can see a almost large to a subtotal perforation, which we will be describing a little later. You can see the handle of malleus, which is extremely bare, and there is a remnant of tympanic membrane on all sides. So, in the end, we will be able to decipher what is the clinical management of this patient. So, coming to the classification, if we were to look at the middle ear cleft once again, it includes the eustachian tube, it includes the tympanic cavity, it includes the adytus, the antrum along with the mastoid air cells. So, when we classify chronic otitis media, it can be classified as chronic otitis media mucosal disease and chronic otitis media squamosal disease. If we were to look at the epithelial lining of the middle ear, we are looking mainly at pseudostratified ciliated columnar epithelium in the lower quadrants or the antero-inferior part of the middle ear cleft. When you are looking at the postero-superior part of the middle ear cleft, you are looking at flattened epithelium. So, why did this come here? This is important for the simple reason that the nature of the discharge and the quantity of the discharge depends on this epithelium. So, now let us go into the classification in detail. We have mucosal disease. This is the recent classification that has come forth. It is divided into mucosal and squamosal disease, and both of these have got active as well as inactive stages. What is chronic otitis media mucosal disease? Active stage and inactive stage. Active stage is when there is discharge, and inactive stage is when there is no discharge. If we look at the previous classification, it was termed as chronic suppurative otitis media tubotympanic disease. So, when we were talking about tubotympanic disease, it had 4 stages, that is active, quiescent, inactive and healed. So, in that staging system, active was discharge was present. In quiescent stage, there was no discharge or intermittent discharge for a period of 3 to 6 months. Inactive stage was when there was no discharge for 6 months, and healed stage is when the tympanic membrane had healed. So, this was the old classification. The new classification either classifies it as active or inactive.